Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Lee Frame, Director of the Integrative Medicine Programs here at GW.
And I'm Janet Rodriguez, the office's Administrative Director. Today we're talking about precision medicine with Anil Bajnath, MD, MBA, CEO and founder of the Institute for Human Optimization and an Adjunct Assistant Professor in the GW School of Medicine and Health Sciences.
The NIH describes precision medicine as an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person.
Dr. Bajnath is conventionally trained in family medicine and integrative medicine. Throughout the span of a decade, he has cultivated extensive firsthand experience in precision, integrative, functional, and genomic medicine. And he's paying it forward by teaching precision medicine to grad students in GW's Integrative Medicine Programs.
Welcome to GW Integrative Medicine, Anil.
Hi, guys. Thank you so much for having me.
We are glad to have you.
We're happy that you could make it.
Yeah, no, awesome. This is wonderful. Thank you so much for entertaining this discussion on a topic that I'm incredibly passionate about. Thank you.
So that's a great place to start. What put you on the path to precision medicine?
Thank you for asking. I think that, healthcare as a whole is a very fascinating landscape of how we got to where we're at today. And if you were to look at the health sciences, and its evolution over the past 10 to 15 years, we've made some pretty fascinating advancements in our molecular diagnostic technologies. And ever since the completion of the human genome, we're able to decode and identify specific hotspots within the gene that makes up our unique individual blueprint. It's been a fascinating area of discovery and personalization within medicine. But the story for me kind of begins 20 years ago while I was in high school and working at a Whole Foods market in the nutraceutical or whole body department, where I got a crash course on nutraceuticals, homeopathy, botanical medicine, and various lifestyle medicine practices. And I was fortunate enough to have met many influencers during that time that have influenced me on the trajectory that I've taken with how I approach healthcare. So I got to say that it was very interesting to have that impression and influence at a young age. It's definitely molded my trajectory in healthcare. And utilizing these different nutraceuticals and integrative therapies has been a hallmark in my approach to healthcare, even prior to starting medical school. But most notably, it kind of also began with my first intro to some of the health sciences, utilizing phase contrast and dark field microscopy in a technique examining undenatured peripheral blood, also known as qualitative cell dynamics, where you literally take a drop of blood, put it on the microscope slide, and you're able to see the various levels of morphological changes. And for me, it was incredibly fascinating to see the unique blueprint that everybody has within their blood or terrain. And this led me down a field of health sciences, furthering my understanding of medical laboratory science and receiving formal training in hematopathology as a medical technician, and combining both the integrative nutritional microscopy with the conventional standards of hematology. And coupling that during my undergraduate studies, I double majored at University of Central Florida in molecular microbiology and medical laboratory sciences. And during my time there, I was privileged to have been exposed to some bright minds and amazing researchers that during that time, it was a very interesting period of growth and development in the field of molecular biology and our understanding of human genetics. As a recent human genome was sequenced and completed, and we're beginning to leverage this information and understand this phenomenon of epigenetics. And taking into account this idea of epigenetics and the NIH's definition, as you explained earlier, of precision medicine, putting two and two together just makes sense. Looking at that environmental influence on gene expression and how we're able to turn on and off these molecular switches and enhance favorable gene expression based upon the signals that we're providing our body, or exposing our bodies, or our exposome is exposed to, and how that influences our overall gene expression. So over a course of, almost 15, 20 years now, just putting it all together and synthesizing it has been incredible in regards to just connecting these molecular dots, so to speak, within precision medicine. Because right now, the landscape of precision medicine is highly focused on cancer and orphan drug discovery and applications. And I think if we were to look a little bit more upstream at leveraging this information of genomics and environment and lifestyle, we could work to prevent a lot of these common conditions that we see here in primary care.
Yeah, that's very interesting. Actually, not too dissimilar from my own, starting off in the basic sciences and sort of creeping your way more into the clinic. And then now you're taking your basic science background in precision medicine and actually applying it in the clinic in integrative medicine. So how do you do that? How do you combine precision medicine and integrative medicine? Or is it a natural fit?
Yeah, it's quite a natural fit. Working in primary care, one of the things that I realized is that essentially most primary care physicians are really well trained functional / anti-aging medicine providers. Because when you look at the most common issues in regards to the common comorbidities that are treated in clinic, it's gonna be your type 2 diabetics, your hypertensive patients, your high blood pressure, and your dyslipidemics or high cholesterol patients. And essentially, all the tools and interventions that we have at our disposal are incredible tools at leveraging and modulating sugar, fat, and salt when you think about it. And when it comes down to the clinical applications of treating these individuals, I think that we're working a little bit upstream, third order, with these pharmaceutical agents. And if we brought it back down to a first order, and when I say these orders, I mean I believe that there's a therapeutic order in regards to approaching individualized care, and it should start with some of the least invasive modifiers before getting into some of the more aggressive agents and pharmaceutical agents. And leveraging diet, nutrition, lifestyle is critical. And, there's countless studies out there that's looked at how, if you're sleep deprived, it influences your tendency towards insulin resistance. If you're getting high fructose corn syrup, it's going to be obviously caramelizing your red blood cells. We're getting too much salt, it's going to be driving up your blood pressure, and we're going to give you a diuretic agent to flush out the salt. So integrating some of the principles of holistic medicine, I think, starts with the individual and seeing where they're at and what their behaviors are, and trying to optimize that, because we all have our unique trajectory, and understanding the individual story is going to be critical at curating the most unique and individualized protocol for the patient. So if diet and exercise are one of those, main issues, I think getting them on a personalized cardiometabolic plan is going to be one of the first actions that I take with most individuals. And going through a deep dive with the nutrition is going to be foundational. Looking at sleep and whether or not that is restorative. I like to leverage various apps, whether it's Sleep Cycle on your iPhone, or if you're Aura Ring. I'm personally using Aura Ring to track my sleeping habits and everything at nighttime, or just simply ruling out obstructive sleep apnea. So going through and approaching the individual and identifying these different patterns that might be causing dysregulation in their metabolomics or proteomics and trying to curate a unique protocol is kind of how I'm attempting to curate this precision medicine approach, but also leveraging genomics. And I'm just obsessed with the integration of DNA testing within primary care. We've seen that the cost of testing has come down significantly over the past 20 years to the past 3 to 5 years. The cost of the whole genome sequencing is under $500 now. And having this information to further identify specific gene polymorphisms or variants is critical at, I think, pinpointing exactly where in their blueprint there might be some issues and working either upstream or downstream to augment or modulate those pathways is going to be very important, especially when applying pharmacogenomics and looking at how somebody may or may not respond to a drug therapy, and nutrigenomics and applying the appropriate food and information to the patient so that they could get on a individualized protocol.
Thank you for that. I'm glad that you brought up omics and genetics and how exciting this field is and how we're learning so much. But on the flip side, we were promised a lot with the Human Genome Project that it's going to revolutionize medicine and just change absolutely everything. It hasn't quite delivered on that because there are other elements of health. So do you feel that this is just a piece and you need to look at everything that could affect the gene expression, the epigenetics? And that's why you're focusing on foundational health issues like lifestyle, sleep, nutrition, and physical activity.
Absolutely. Dr. Jeffrey Bland, is one of my main mentors. He's the founder of the Institute for Functional Medicine, and he's made some amazing comments. And one of his comments that has resonated with me is that your genes are communicating with your environment and is marked by experience. And I think that epigenetic phenomenon is critical at, again, influencing favorable gene expression. And I do believe these modifiable lifestyle factors are critical at optimizing in order to influence your gene expression, especially with more recent research on RNA technologies and looking at it, being able to measure these epigenetic clocks and be able to apply it clinically and see whether or not we're aging at a more accelerated rate, and looking at this idea of your biological age. So I do feel as though these lifestyle factors are going to be the main regulators that need to be optimized first and foremost in this therapeutic order, because you could sit here and take all sorts of drugs or medications, but if you're not addressing your modifiable lifestyle factors or MLFs, nothing will improve. Because looking at it again from that multi-omic perspective, we have many different inputs influencing this milieu or internal biological terrain that influences whether or not our bodies are going to be susceptible to infection, or if we're going to be able to metabolize things appropriately, looking at the gut microbiome and how that influences our body's receptivity to foods and nutrients as well. And it's our response to the glycemic our impact to various foods. So there's all these different factors that should be taken into account. I do agree with the statement that, we thought that the human genome was going to be the holy grail and it was going to do all sorts of amazing things. But I think it has its limitations unless we start entertaining CRISPR and gene editing, but that's a whole nother discussion. But clinically, we could use this information to predict medically what kind of therapies and drugs individuals would respond better to, and what kind of nutrition would be more beneficial for individuals versus others, especially with like looking at oxalates, and MTHFR is a big one. And we could also look at it in the context of neuropsychiatric issues and neurotransmitter synthesis and degradation pathways. So the blueprint is still there to leverage and could explain a lot for the individual and why they might be feeling a certain way. But harnessing that potential is going to be critical.
So, Anil, what are some examples of how you utilize that approach in your practice? Maybe things that other providers might find useful to know more about.
Perfect. Yeah. So again, I like to take a genome to phenome approach to healthcare. And most individuals, by the time I meet them, are on tons of medications. And, that I call them the basic medications that we're very common in clinical practice right now is going to be your anti-diabetic meds, high blood pressure meds, and cholesterol meds. And looking at how we could use this information from, again, starting from your genomic blueprint, would be looking at, from a pharmacological or pharmacogenomic perspective, whether or not the medications are correct for you, whether or not you're statin intolerant, and looking at polymorphism SLOCO 1B1, looking at whether or not you have other underlying pathways that might be dampened. And by that, I mean, when you have these genetic polymorphisms, it influences enzyme production and function. One of the more common ones that we see is MTHFR, or the methyl-tetrahydrofolate reductase pathway. And there's varying levels of variation within that. And that influences everything from monoamine neurotransmitter synthesis to hepatic detoxification to cardiovascular health. And bridging that gap from a genome to a proteomic or metabolomic perspective would be using a surrogate marker of MTHFR, which would be like homocysteine. And if an individual has MTHFR polymorphism, and there are variations within that, and they have elevated homocysteine, clinically, you could use that biomarker as a means of gauging that cardiovascular stress, and you could treat it nutritionally through methylating agents. One, you could enhance the different, give your body the foods needed to help support methylation. Or two, you could actually go in there and support that pathway conservatively with additional methylating agents such as folic acid, B12, trimethylglycine. Another important polymorphism that I look at is, for example, vitamin D. I run vitamin Ds on almost everybody, and needless to say, a very high percentage of the patient population is low on their vitamin D status, including myself. And within my blueprint, I have a VDR polymorphism, or a vitamin D receptor site polymorphism. So my levels are going to be genetically predetermined to be low. So my need for vitamin D is a little bit higher, but I also keep that in mind that if it doesn't budge too much or respond clinically like some of my other patients, that it's okay, that I don't need to go in there and mega dose, but just be mindful that that vitamin D receptor site is influencing my receptivity to treatment. So, but another big part of leveraging this information in precision medicine is the role of the microbiome. Now, this is still in its infancy with the Human Microbiome Project, and we still don't have all the information needed to make informed, targeted therapeutic applications. However, globally speaking, if we're able to identify that there is a dysbiosis or a imbalance in the gut microbiome due to either the resident population or the metabolites for which the microbiome is producing, we could use this information to remove specific foods and try to take a 5R approach to healing the gut. And there are various labs and testing that is available out there to gather this information so that we could, again, clinically have a more targeted approach to repairing and restoring normal gut function. So synthesizing all this information using your DNA blueprint, and microbiome, biometrics, and various biomarkers is the aim of my organization, the Institute for Human Optimization, is connecting those molecular dots.
This conversation reminds me of ones we've had in the past, Anil, including conversations we've had about the Institute. So I know that it's been in the works for at least 2 years or more, but it's finally open. And could you tell us what it is and what you hope to accomplish with the Institute?
Oh, thank you. Yeah, actually, the Institute's been a dream of mine since undergrad. When you look at healthcare right now and how it is, it's a very interesting model that we have. It's a sick care system where you go in there, you might get on average 6 to 12 minutes with your primary care provider, and you're left with maybe 1 or 2 additional drugs, and the patient is left wondering, what do I do from here? So the Institute for Human Optimization is this idea of not being a sick care clinic, but a health optimization center where you could go there and take a deep dive into your own information, what I like to call N of one research, where we're looking at you as an individual and we're dissecting everything from your genetic genomic blueprint to your microbiome and those biomarkers and those biometrics, and what we're calling a scientific wellness approach to leveraging data. And it's been in the works, and we're actually, until COVID hit, we're looking at a space in Columbia, Maryland. But that's forced us to pivot and just leverage our online platform. And now we have the capabilities of delivering this completely virtually and getting you the kits needed for DNA testing, microbiome analysis, and so forth, and then being able to do consultative services virtually to explore those options. But there are some metrics that I would like to gather in person. There's another technology that I use clinically called PhysioAge. PhysioAge is a software program that leverages various technologies, including looking at arterial plethysmography, which is arterial stiffness, and it helps generate this cardiovascular age. And there's some other inputs. We look at your pulmonary age using traditional pulmonary function tests. And there's a few other markers that we look at to assess your neurocognitive status, your immunological status, and also your epigenetic age. And for me, if patients come to me in person, this is what we're attempting to do, is paint this picture of your biological baseline and your biological age. And we're attempting to move that needle backwards and demonstrate epigenetically and through telomere testing that we're enhancing favorable gene expression and able to reverse that biological clock through these interventions, these personalized interventions. So that's the main aim of it. It's been a work in progress, and it's coming together.
So I think that's a great example of how, we have to adapt and overcome in this post-COVID-19 world. And one of the silver linings that I hope comes out of this pandemic is telehealth and the realization that it's not only possible to help patients remotely, but it's actually more convenient for them. They don't have to leave work. And if you can do as much as you can remotely, then you can still have them come in when need be, but you're really optimizing that time with them. I'm wondering if you have any other thoughts about COVID-19 and how that has changed practice, or maybe clinical pearls that you want to share with your peers.
Yeah, absolutely. Thank you. With COVID-19, I've been doing both a clinic, working at an urgent care clinic next door to Hopkins here at Bayview. And I've also been doing telemedicine consults virtually from patients all over the country. With the pandemic, it's lifted up a lot of the state regulations have been unrestricted. And I've been able to communicate with patients all over the country. And it's very interesting to see how this has influenced everything. And it's just incredibly fascinating. So with COVID, I mean, it definitely caught us at a very interesting time, and it caught us flat-footed in many respects. We weren't prepared for a lot of the falling out of everything from the personal protective equipment to the resources and testing and everything else. So just, within our lifetime, we were able to experience our first major pandemic. And it's incredibly interesting to see how it's being promoted, one, globally, uh, and how it's infecting very specific targeted populations. You hear about the young physicians that are becoming ill with COVID, and there's a few young providers that have passed away from this, and you're hearing about the elderly and so forth that are more susceptible to this issue. And it makes you wonder who and what and why is going to have this more fatal clinical response to the issue after contracting it. And I'm seeing COVID patients weekly, and it's very scary to see how people are tipping. And by tipping, I mean they're desaturating and they're becoming very critically ill very rapidly. And one of the uh, comorbidities that I've been seeing with my patients personally, and has also been backed by the literature, are the individuals that have this immunosuppressed state or a dampened immune response. And that's with obesity and type 2 diabetes and underlying cardiopulmonary disease such as COPD. And for the bulk of the patients that end up going to the hospital and ICU and everything else that I've triaged, and that we're triaging at my center, those are the comorbidities that I'm seeing that's influencing their hypoxia or low oxygen status. And tying it into where we're at today with, or using this precision-like medicine model and this idea of biological aging, one of the hallmarks of biological aging is immunosenescence, where we're producing or have reached this potential with our immune system where it's no longer producing quality immune cells. Every 10 seconds, our hematopoietic potential is we're putting out 1 million white blood cells, 10 million red blood cells, and I think it's 23 million platelets. And I'm sorry, 30 million platelets. So leveraging this information in terms of hematopoiesis and our ability to synthesize new cells into circulation gives us an opportunity for immunological regeneration and giving your body the cofactors needed to help put out a more robust, stronger immunological programming through different cofactors. We hear about zinc and vitamin D. Those are all very important components or nutrients needed to generate the appropriate immunological responses. And I don't want to get into a crash course on immunology, but we have varying levels of our immune system that deal with these stresses. One of them being our innate immune system, which is going to handle anything that we come into contact with on a regular basis versus our adaptive or humoral immune response. And being able to leverage and give your body the appropriate cofactors needed is going to be very important in this equation to help battle and combat against any viral infection. Additionally, this idea of the cytokinetic storm. Well, the cytokinetic storm that you hear about is mediated by this NLRP3 inflammasome, but it's a bigger discussion about this idea of sterile inflammation, this idea of chronic sterile inflammation, for which a lot of individuals are living with on a regular basis. One of the biomarkers that we like to look at is high sensitive C-reactive protein and ESR, or erythrocyte sedimentation rate. These are our very nonspecific inflammatory markers that tell us that our body is in this chronically inflamed state. And this idea of sterile inflammation being we're not necessarily, this inflammatory response wasn't triggered by some sort of infectious state, but more so it's inflammation that is generated at a baseline secondary to obesity, and dietary influences that could cause maybe this postprandial metabolic endotoxemia. What does that mean? After you eat certain foods, your body seeds certain bacteria into the bloodstream, and it causes this chronic inflammatory response. So all these factors mediate this process of sterile inflammation. And unfortunately, if you're carrying a little bit more weight or have a higher BMI, it predisposes you towards this cytokinetic storm. And that's kind of what I'm seeing with the patients that I have to send to the ICU, is that they might have these other comorbidities. So it's really interesting time right now that COVID has made us take a step back and made us realize, oh no, how do I strengthen my immune system? How do I decrease these comorbidities to prevent me from, if I do contract this illness, to make sure that I don't end up on a vent? And I've had several patients end up on a vent, and I've had coworkers, unfortunately, end up on a vent. And it's just very interesting time right now. And so with everything, philosophically speaking, I think this is a unique time for us to really self-reflect on our patterns of behavior and to empower ourselves with just restoring normal routines, or developing better dietary habits and sleep habits and exercise habits. Even though we're home, we could still do these little fitness routines at home to help get our heart rate up. Because again, exercise is a simple mathematical equation of 220 minus your age times 0.6 or 0.8 or 60 to 80% of that target heart rate over a specific duration of time. And, just going up and down stairs or doing burpees or just doing, calisthenics could get your heart rate where it needs to be, just to stimulate that favorable cardiovascular response. So it's yeah. I'm sorry that was a little out there. I tied into all sorts of different things there, but yeah.
No, I couldn't agree more. And I think that's exactly the type of, systems thinking that COVID-19 is actually bringing to the forefront. I think people like you and us in GW Integrative Medicine have this systems thinking thought that this chronic inflammation leading to chronic disease is not just problematic to the individual, but it's problematic in a public health scale, because people are setting themselves up for further illness. And if we can do anything to improve upon that, I hope that COVID-19 is really highlighting that.
I agree. It's definitely, left us looking at, all these different cofactors that could be potentially contributing to exposure and development of these different infections, just from hand hygiene and how we're hand hygiene and respiratory droplets and everything else, is transforming the way we interact with individuals, and just even from the foods we're eating to the thoughts that we're having, and just everything has been challenged by this pandemic. And I'm hoping to take away from this more of an enlightened stance globally on the importance of these modifiable lifestyle factors to strengthen and enhance our resilience to not just COVID, but other diseases. Because one of the first things that you saw in response to this issue was people were flocking to the health food stores and purchasing tons of supplements. And, again, I don't agree with going in there and self-medicating without a specific purpose or supervision of a trained healthcare provider. But, we've seen various levels of evidence on vitamin C and its role in modulating immunological activity, vitamin D and zinc and all these different cofactors. That's the medicine that we've been reaching for in the absence of a specific antiviral agent, in the absence of a vaccine. We're forced to now leverage and empower our immune system to help build that resilience. And I think it was a switch that was turned on for us globally to really pay respect to our bodies and have a deeper appreciation of our cells and this idea of immunological activity and resilience. So it's been very interesting to see that.
Anil, you've given us so much to think about, and including the fact that this topic may be good for next year's Sung Symposium.
I would agree with that.
Absolutely. And it's interesting because one of the deep dives that I've been taking more recently has been exploring the field of aging. One of my secondary boards is the American Academy for Anti-Aging Medicine and Regenerative Medicine. And there's a paper that I've been just obsessing over for the past few weeks now. I've just been nerding out completely on this publication from Cell in 2013 that looked at the hallmarks of aging. And philosophically, in medicine, you're either going to age, which is a loss of function, or unfortunately get cancer, which is a gain of function. It's this constant dualistic approach to how we see the aging body, and health and disease. And with the Sung Symposium this year, I've heard the topic of health, this idea of health, brought up repeatedly, and the definition of health not merely being the absence of disease, but in looking at all these other factors that define what is health. And I think, it's definitely not the absence of disease. And it also explores that idea of the homeodynamic adaptive capacity to deal with various allostatic loads. And I just said a lot right there, but, looking at this, we're not static. We're in this dynamic, fluctuating existence throughout the day, throughout our life. And our goal is to maintain some level of homeostasis and to mitigate and minimize any perturbations that would lead to imbalance. And this adaptive capacity to allostatic load or stress is what's going to influence and tee off a lot of different potential imbalances within our body. And how do we deal with that? But going back to that idea of these hallmarks of aging, it ties right into everything that we're talking about in regards to precision medicine. There's 9 fundamental hallmarks of aging, and not to get too caught up, but one of them is looking at this idea of genetic instability and how that's influenced by various mutations or even epigenetic stress. Well, actually, there's one of the hallmarks is epigenetic alteration. telomere attrition, dysregulate nutrient sensing, and that ties into this idea of mTOR and fasting and AMP kinase. There's this idea of cellular senescence, altered extracellular communication, stem cell exhaustion, mitochondrial dysfunction. These are all part of the hallmarks of this biological aging process, and what we as integrative and functional clinicians are addressing on a regular basis. And I really think that taking a deep dive into this idea of aging and how we could reverse that clock, so to speak, so that we could be aging more gracefully. One of my mentors, again, too, was Andrew Weil growing up. I had the privilege of doing an elective rotation with their integrative medicine department as a medical student. And he wrote a book, several books on this idea of aging and aging gracefully. And it's always resonated with me as a young physician. That should be our focus, is promoting longevity and wellness, and is actually the key idea, or the main idea of the book that I'm about to release. I don't know if I got to mention it to you guys, but today I'm getting from my publishers a rough draft of the book with the working title, The Longevity Equation. And it's something that I'm excited to share with everyone, this idea of aging and aging gracefully, and how we could do things to, quote unquote, biohack ourselves to promote longevity.
Well, congratulations on that. That's exciting. You'll have to let us know when it's officially out so we can share it with our listeners.
And bring you back on the program to talk about it.
There you go.
Awesome. Thank you. Yeah, I would love to. Thank you.
So that is all the time we have for today, but I think we gave you some food for thought, and you can look forward to next year's Sung Symposium. If you missed this year's Sung Symposium on wellness and longevity, it is available on our website, and we will include a link to it in the show notes. Thanks so much for joining us, Anil.
Thank you, guys.
This is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Lee Frame.
And I'm Janet Rodriguez.
Thanks for listening.